therapist, physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today's video is how to stand and lean forward pain-free with back pain or sciatica. Now this comes up quite often during the day, and the typical day. It does for Brad and I for sure. And we want to make sure you're doing it correctly because it's another time where you can irritate your back, irritate the sciatica, and make it harder again to heal. So,
well, a good example. I'll have a back pain patient come in and I'll say, well, when does it bother you? And they say, when I'm brushing my teeth, when I'm vacuuming or making the bed. And it's things where they're leaning forward, not a lot. They're not lifting anything. They're just from this posture to this posture can put a tremendous amount of stress on the low back, particularly when it's injured.
Particularly if you do it wrong.
Yes.
So if you're leaning forward on the bed or over the sink, and you're rounding out your low back like this, which is what people typically do.
Yep.
You may not even realize you're doing it.
Right.
You almost may need to have somebody watch you or film you because you may be surprised how poorly your back looks when you're doing this. Now, I feel quite often, we work with patients in bed, and I feel quite often when I lean over the bed, and I do work on doing the things that we'll talk about today.
Sure.
But the first thing is you want to try to keep the back in the locked in position. We've mentioned this locked in position on other videos, but what that means is you're going to really, again, I always do the wrong side.
Yeah, so we can.
Did I get it right this time, Brad?
Bob is using the stick so we can see that neutral position, the locked in position, so that the low back is where it should be with less stress.
Yeah, mention the 3 points of contact again, Brad. I know we've mentioned it a million times.
It's here right below the belt line on the sacrum, right between the shoulder blades and then the head. And if those 3 places have contact with the Booyah stick, we have a good neutral locked in posture.
Spine. And what you'll see here, what I want is when you're bending forward, really all the movement is coming from the hips. The back is locked in.
Right.
You know, the back is not moving. The back is not bending. The hips are moving.
So if one of those 3 points becomes without contact, either the head, usually it's the head or the low back, and here you can see the stick is rocking. Then you know you've got a lot more stress on the low back.
Right. And this is something you may want to practice. I practice it with squats.
Sure.
I do squats, and it really carries over to my life.
Yep.
But sometimes just visualizing this will help you lean forward correctly.
And if you're a weightlifter, if you've been around, they call that hip hinging. So we're keeping that. And yoga, I think, really they try to stress that too. But a lot of people just aren't aware of it because it's not natural.
It's like you want to think of your back as being in a cast.
Sure.
And you can't break the cast. The hip can move, but the back can't.
Right.
Now, another thing you might try, though, is you might try varying. If you're having a lot of pain in the back, even still when you're locking the hip or the back in place, you might try varying how much arch is in your back.
Sure.
Sometimes putting a little more arch or putting a little less arch. And this is sometimes difficult for people to do, but it can change how much pain you're having.
Right. And that's done with the pelvis and your abdominal muscles, where if you look at my hands, I can change my pelvis. They call it the anterior and posterior tilt by tightening your stomach. I know with me personally, if I tighten my stomach up, and I get into a position, I can, when my back is irritated with spondylolisthesis, it's a chronic thing I have, but I've learned to adjust and make it feel good just by doing that.
And you alluded to the other thing you could try. You actually, when you're leaning forward, you want to tighten your abdominals.
Sure. Yep.
And you can tell that they're tightened by just poke your fingers in there, and are they're tightened up better or not?
Right.
If they're not, you know, if you're the Pillsbury Doughboy, remember that guy? And you can poke in. Obviously, it's not tightened up there.
Right. So, yeah, it's a lot of awareness. The other thing is the height of, for example, the sink. We have 2 bathrooms in our house. One sink has a newer one. It's 4 inches taller than the older one. And it's amazing.
What a difference that makes.
Difference. It makes me from standing here and on the lower sink, I'm here. And even if I don't have back pain, I feel it. You know, I've pretty aware of my body because that's what I do for a living, and with exercise. But there's 4 inches can make a big difference.
Big difference. Also, what you can do if you're doing dishes on a regular basis and a sink, we used to recommend this when I worked at Mayo. You take 2 tubs and you put one tub upside down in the sink, and you put another tub on top of it, so that raises up the sink in essence.
So then you just use your water and the taller
sink. Right. Now you can also get closer to the job by doing what, Brad? By opening the cabinet.
Oh, yeah.
He looked at me like he didn't know what I was talking about.
Get closer to, so if this would be the sink here, open up the vanity door, and then you can get closer. You can even put 1 foot up in here. Sometimes that will help take stress off of your back. But yeah, getting closer to your workspace.
Now it also helps to, like if you're working with the bed, sometimes to put the knee up there.
Yeah,
you can get a little bit closer. The other thing that really helps whenever possible is to take some weight off the back by putting one hand down.
Right.
This does an incredible job of,
sure.
And you can even do that if you're bending forward, is put a hand on a thigh.
Yep.
And lean forward and work like this. Makes a big difference. Really takes a lot of stress off the back, because even if you're keeping it straight, your back tends to not have that much endurance, and this gives it a rest.
Right.
By taking some of the stress off. So, anything else you want to add, Brad?
No, I think we've covered a lot of it. Again, it's locked in back, keeps things close, higher the better.
Yeah, there we go. Watch our next video in this series.
Thank you.